Hi, I'm Vanessa Carlisle. Thanks for being here with me today. Before I proceed, I just want to acknowledge that I'm going to be talking about abuse, trauma. I'm going to be storytelling a bit about some experiences that might be difficult for people who have a trauma history. And so because I'm used to being able to hold space in person and interact in person, I'm going to ask that you take double good care of yourself if you're a person who might be triggered by this material. I love how this conference is set up for there to be a lot of somatic practice and space for breath and stretching and moving. It seems obvious, and it also is, it's not common, at least in the conference world that I'm mostly a part of. So I'm really grateful for that. And I also just wanted to make sure that I acknowledge that the material that I'm going to be working with today can be hard on the heart. So thank you for being here. I know I'm not the person that most of you were expecting to hear from today. So again, just gratitude for your presence and your engagement, your participation in this conversation. I'm really looking forward to the live section where we can have more dialogue and more interaction. I would like to acknowledge that I'm currently on Tongva, Chumash, and Kizh land here in South Los Angeles. And that today I am going to be sharing some stories and thoughts on abuse and caregiving, abuse and death work. I know the question is when your abuser dies, but there's just so many other questions around the cluster of experiences of people with trauma history when it comes to caregiving and seeing people, their families, or their frontline circle through the experience of dying. So when I spoke with Lashana this week, she used this incredible phrase of growing some tools together. And I'm just been really working that phrase over and over. I love it. And so that's what I'm seeking to do here is to use some narrative, to use some personal experience to sort of open some space to grow some tools together. So I'll start by saying a story. I am currently a caregiver for my 95-year-old grandmother. We brought her home because of COVID. She was going to die alone in a hospital after a fall. And so I and my mother and one other person have been caring for her primarily for the last 3 months. It's been a wild ride. And I want to share one episode with you that has really informed me in the way that I'm thinking about just being a death doula for other families, talking about abuse and trauma triggers with my own family. So one night I went in to do the 3:30 a.m. diaper change. And unlike most nights where grandma is actually very complacent and compliant, she's in late stage dementia, so her capacity to meaningfully communicate and consent is shifting. But unlike normal, she was very reactive, very upset, very agitated. I was trying really hard to get her to kind of understand that she was not being harmed, that there wasn't a stranger in her room. You know, there was a lot of fear. Anyway, I was going through it with her, trying to help. And she was about halfway through the diaper change when she got really agitated and balled up her fists and just started hitting me as hard as she could. She was screaming and yelling, which frankly, I didn't know she could still do. I just hadn't heard her use that kind of power in her lungs. And it was really startling. And in the moment of it happening, I experienced a kind of split in my consciousness that it's a familiar experience, but I'm going to describe it. there was my mind, my rational self, my cognitive, and that part of me was able to say, this is dementia, and she loves you, and she's just scared, and she's working something out, and your duty is to make sure that she's clean and dry and as comfortable as possible, and you need to finish your task as gently as you can, and then try to calm her down, and all will be well. The other part of me that was there was panicked and hurt and scared, and why is my grandma hitting me? My grandma is hitting me. Why is my grandma hitting me? It was the middle of the night, and I didn't have a lot of the capacity to sort of work my way through the experience. The following day, I was still very affected by it. And, you know, in totally well-meaning fashion, my mom and some other people were trying to convince me that, you know, it's okay, she's okay, you're okay, no big deal. You know, sometimes this is going to happen because of where she's at in her process. But I could not, I just was so affected by it. I was having a lot of trouble letting it go. I became impatient with my own capacity to move through the experience. And so I just got very twisted up about it, and I had to do some work. And one of the things that emerged was I recognized that I was actually triggered, that I'd had memories from the past of being a caregiver for my abuser. And that although the situation with my grandmother is obviously a completely different situation, she is not an abuser in my life, the very simple experience of being hit by someone who I had a bond with, had a love bond with, triggered a bunch of old feelings in me about caregiving for someone who was in the throes of active addiction, suicidality, and self-harm. Why? What? I was floored by starting to understand that I was having memories, intrusive memories, and difficult feelings come up from this past experience. It just didn't occur to me, actually, that they would necessarily be connected because the situations were so different. And the way that my abuser in my past had handled my care was just a completely different experience than my generally sweet and wonderful grandma. So I tell this story because what emerged from it for me was an understanding that people with abuse histories and trauma histories, of whom I am one, are often still, even years out, trying to figure out how that experience is affecting life now. What's going on in life now that is still being affected, and how to move through those experiences. I have been doing active, direct, conscious healing work on my traumatic abuse experiences. But for many people who haven't entered a state of wanting to do that kind of work, those experiences are actually just working their way into daily life all of the time. And they might be showing up as physical symptoms. They might be showing up as irritability or depression that isn't actually cognitively linked to the experience of trauma, especially if the trauma happened in childhood. So the complexity of dealing with abuse and trauma as a caregiver is something that, I think there's support out there about. When your abuser dies is a question you can Google, and there's like a lot of thought out there, a lot of tips and tricks and support for the complexity of it. But personally, I still was perceiving my abuse history and my trauma history as a barrier to my being good at caregiving. And so I am now asking the question, how do I transform my understanding of abuse and trauma so that I can see resource, wisdom and connective potential rather than lack, isolation, the broken narrative? How can I stop thinking I'd be a better caregiver if I wasn't an abuse survivor? And how can I start seeing my experience as an opening for conversations about the complexities of grief and care and the difficulty of unresolved issues when abuse has been present? Working with families who have abuse and trauma in the family system is going to be the provenance of anyone who's doing death care work, right? And the bad behaviors show up in grief. The painful behaviors, the regressive behaviors, we can call them whatever we want. When people are in pain, some of their worst traits sometimes come to the surface. And so even if you are not a person who has your own connection to abuse and trauma, you are going to be connected to it just by way of being around people in grief, right? So I know that there's a lot of wisdom in this room already, and I'm looking forward to hearing from you. I guess what I'm trying to share here is that the shift that I'm making now as a death care worker and also just as a caregiver right now in the moment is that I started to understand that where I'm coming from, the history that I have and the decisions that I've made, that they are not a barrier to my giving good care. They're not a barrier to me doing a good grief process. They're actually a source of information and wisdom. So what information and wisdom? Well, one phrase that kept coming back to me after this experience that I had of kind of digging into why it was so hard that my grandma had been hitting me. One of the things that came up for me was a phrase which is, I don't need to take it personally, but if something happens, I do need to take care of my person who is me. And this is a way for me to remember that when harm has come to me in the past, I was always trying to figure out what I had done wrong, how I was perpetuating it, how could I stay. I had a lot of things to say to myself about the harm that was coming to me. I was definitely in the weeds. And now I can say, whatever that is, whatever's happening, if there's hitting happening or yelling happening or resistance happening or shame and blame, all those things, that I actually don't have to have that be about me. But if it's coming at me, I probably need some aftercare. I probably need a soft place to land. And that there is a difference between absorbing it all and trying to be the strong one and being a person who can not actually absorb those things, not take them in, not become, bound up in internalizing them. That I can be a person who can see them, hear them, hold space for them if need be. But that the focus for me is, after that happens, what am I doing to restabilize myself, to take care of myself? After this experience with my grandmother, I minimized it because I didn't think I should be so upset. And it took me a little while to understand that what I was doing was actually not allowing feelings about the past to come to the surface. So I had to let that happen. I don't have to take what's happening personally, but I do need to take care of my person who is me, me first. Even in the situation where I'm a caregiver, right? The old oxygen mask. I feel like I'm relearning that all the time. I also have been learning about welcoming all the experiences and all of the multiple realities that are happening at once, and really seeing them as the place where wisdom is. And so, my bond with my grandmother is very deep. I feel her care for me. Even in her dementia, it's something that bubbles up. It's very clear. And so the harm that I felt when she was fighting me was just about this very simple, very real bodily experience of betrayal. Someone who is safe for me is no longer safe. when your abuser dies, maybe you would think that you would become safer, right? And there are definitely people, I think, who have a sense of like relief, who have a sense of good, I'm safe now, right? But it comes at price. It comes at cost. And the complex, gnarly, like messy, gnarly world of grieving and dealing with, an abuser who has died, or even an abuser who has simply exited your life. The incredible complexity of the feelings that happen there is something that I feel more equipped to make space for as a person with that lived experience. I feel more equipped to sit with that difficulty. And that is a way in which I have been able to transform my lived experience into something useful for others. I did recently do some grief support for a client whose father died of COVID. He'd been an abusive dad, and he died after years of very poorly managed dementia and a lot of dysfunction in their family system. One of the things that came up when we were doing her work was how she was unable to feel this relief, like the freedom of he can't harm me anymore. She was unable to feel some of that relief without immediately feeling guilty that she hadn't forgiven him before he died. It was very specific. It was a guilt about feeling like she should have or could have forgiven him before he died. And that now she was always going to have to live with that never happened. That connective moment of forgiveness for her father didn't happen before he died. And I think that that sort of loose ends feeling is extremely, extremely common when there's been abuse and trauma, right? My instinct now, and the way that we proceeded, and this definitely comes straight out of being a person who has lived experience of trauma, was I asked her if she wanted to do a forgiveness ritual for herself, not for her dad. Whatever needed to get worked through the process of grieving her dad, that's going to be complex. That's going to take a long time. I actually think that the work that she needs to do there is, it's obviously it's her own journey, but it involves a starting place of forgiveness of self, because her guilt was stopping her from feeling a lot of other things. Her guilt was like the block. The guilt was actually the plug. And if we had pulled that plug, all these other feelings were going to come, right? And they would be able to move. She felt guilty that she hadn't forgiven him before he died. And we worked on her forgiving herself for not forgiving him. It's layers. It's a lot of layers. But it was so helpful. It was so helpful. And so for people who have lived experience of trauma and abuse, one of the things we often do is like, we can actually forgive our abusers sometimes faster and easier than we can forgive ourselves for either staying in it as long as we did, for allowing that person to hurt someone else, maybe, for, all of the years that we lost, trying to care for this person, especially for me as a person who was caring for someone who was like rigidly unable to step into their own care. I had to forgive myself for the level of codependency, martyrdom, whatever you want to call it, that I had entered there. I had to start there. That was the starting place before I was able to even enter some of my more complicated feelings about my abuser himself. So, being a caregiver now, having some of these feelings triggered by an experience with someone who is not abusive at all, and acknowledging that that's going to be part of my experience as a death worker, and also just as a person who's living my life and trying to deal with my own feelings, all of this would not have been made possible. None of this thinking, none of this working it through would have been made possible without my having a lot of somatic practices that allow me to make discern what my feelings actually are and to feel them as they change and move. So the ground floor, I guess, of all of this is to think in some way about how to build in somatic practices, whether you're a survivor of trauma or not, to build in somatic practices that really allow you to feel the complexity of these feelings. I'm reminded of Daniel Tiger. If any of you have little kids, you know who this is. And he has a song that goes, sometimes you feel two feelings at the same time, and that's okay. I love it. Sometimes you feel like 18 feelings at the same time, and that's okay. And that is something that I needed to work on just with my own healing, but also in order to see the wisdom in how my experience could help me create a safer space for others to go through their process. So thank you for listening. Thank you for being here. And I'm looking forward to continuing this conversation over the course of the rest of the hour.